Cyclin-dependent kinase-like 5, CDKL5. Sounds like a bunch of gibberish to most people, but to about 1,600 people worldwide, this word means everything. Today I'm going to talk to you about a seizure disorder that one of my children supposedly had. Having lived with this disorder for the last 9 years, this has given me a leg up on the information and being able to feel confident in telling you about this disease. CDKL5, what is it, how is it diagnosed, and what happens to these children once the diagnosis is done and over with. CDKL5 isn't only a debilitating seizure disorder that affects the brain, it also affects every aspect of the person's life in multiple areas of the body. Many people would probably like to know what exactly CDKL5 is and how it affects these children. CDKL5 stands for cyclin-dependent kinase-like 5, or CDKL5. This is a protein within the body that helps brain development. If this is not made correctly or has a mutation, deletion of any sort, there are problems within the brain, which then causes a CDKL5. Many people affected with CDKL5 started having seizures within the first few months of life, some within just weeks of birth. These children have severe developmental delays and usually have smaller head circumferences than normal children who have normal development or normal brains that have developed. This is due to the abnormal CDKL5 protein. Since we now know what CDKL5 is, we should probably discuss the physician's diagnosis with it. The first step in diagnosing is stating your concerns, preferably to your PCP, who will then refer you on to a neurologist. Although this is rather difficult to do due to the fact that this is so rare, only 800 children are diagnosed, 1,600 families are affected, or parents are affected. I would recommend an epileptologist and not just a neurologist due to the fact that epileptologists specialize in seizures. Once you have spoken with a neurologist, they will then order an EEG, which put electrodes on your head to see the brain waves. If there is an abnormality, which there are with most of these children, then you will be referred on to have an MRI. The MRI will then tell you what the brain looks like, how much gray and white matter there is, and with many of these children, there is either a very small corpus callosum or there is none at all. The diagnosis is done and over with. What comes next? Treatment, other health concerns? Well, all of the above. The struggle doesn't end just with the diagnosis. Life after diagnosis is treatment of not only seizures, but other health problems. When seizures are being treated, there is no one single drug that treats these. Usually it's multiples, and that doesn't always work. These kids usually never are seizure-free. Many of the kids have scoliosis problems, which is the curvature of your back, where a normal person would have a straight line. These kids' bodies curve, which then presses on the organs. Children also with CDKL5 have a lot of respiratory problems due to the fact that they are unable to stand and get mucus moving. So it just sits there, and these kids end up getting pneumonia and then could eventually not make it through and die. People with CDKL5 have multiple types of seizures. Infantile spasm is usually the first one that starts. The best way to describe it is when you're asleep and your body jolts. You feel like you're falling and you try to catch yourself. Then they turn to myoclonic, tonic, and tonic-clonic seizures, all of which have very violent muscle contractions. A lot of people think of grand mal seizures when they see these. As you can see, CDKL5 is rare, and there isn't a lot of information to go out to people, so the information that we do have is vital. CDKL5, what is it, how is it diagnosed, and what happens to these children once the diagnosis is done and over with? CDKL5 isn't only a debilitating seizure disorder that affects the brain, but it affects almost every aspect of the person's life. How do you think you would feel if someone you were close to had this debilitating disorder? Could you and the ones around you handle it? I'm sure you could. Just watching these kids jump through the hoops they do every day is inspiring. They are some of the strongest people that I've ever had the chance of meeting and to be able to raise. One of the most amazing things all these kids have in common besides the seizures is the fight to keep going.